Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. Most medical imaging technologies create pictures of the body's anatomy. But what if you could actually see how an organ is functioning? That's exactly what nuclear medicine does. Instead of sending energy into the body like X-rays or ultrasound, nuclear medicine introduces a carefully selected radioactive tracer that allows specialized cameras to detect how organs and tissues are working. Today, we'll explore how radiopharmaceuticals work, how nuclear medicine images are created, and why this fascinating specialty plays such an important role in modern healthcare. The word radiopharmaceutical combines two ideas. A pharmaceutical is a medication or compound designed to travel to a specific part of the body. A radioisotope is a substance that emits small amounts of radiation that specialized imaging equipment can detect. When these are combined, they create a radiopharmaceutical. Depending on the examination, the tracer may be injected into a vein, swallowed, or, less commonly, inhaled. Once inside the body, it travels to specific organs or tissues based on its biological properties. Different radiopharmaceuticals are designed for different clinical questions. Some collect in bone, some in the heart, some in the thyroid, while others are used to evaluate kidney function, infection, or certain types of cancer. Once the radiopharmaceutical has reached the target tissue, it begins to emit tiny amounts of energy. For many nuclear medicine studies, this energy is in the form of gamma photons. These photons leave the body and are detected by a specialized instrument called a gamma camera. Inside the camera is a detector system that converts incoming gamma photons into electrical signals. Powerful computers then analyze millions of these signals and reconstruct them into diagnostic images. Unlike an X-ray, where energy travels into the body from a machine, nuclear medicine imaging detects energy that originates from within the patient's body after the radiopharmaceutical has been administered. This is one of the key differences that makes nuclear medicine unique. Another unique feature of nuclear medicine is that it often shows function before structure. An anatomical image, such as an X-ray, computed tomography, or MRI, primarily shows what organs and tissues look like. Nuclear medicine helps answer a different question. It shows how those organs and tissues are functioning. For example, a bone scan can identify areas of increased bone activity. A myocardial perfusion scan evaluates blood flow to the heart muscle. A thyroid scan demonstrates how the thyroid gland is functioning. PET imaging can show areas of increased metabolic activity that may help evaluate certain cancers or other medical conditions. Because function often changes before anatomy, nuclear medicine can provide valuable clinical information that complements other imaging modalities. You may have heard the terms SPECT or PET. These are advanced nuclear medicine imaging techniques. SPECT, which stands for single photon emission computed tomography, acquires images from multiple angles around the patient and reconstructs them into three-dimensional datasets. PET, or positron emission tomography, uses different types of radiopharmaceuticals and specialized detectors to create highly sensitive functional images. Many modern scanners combine PET with CT, allowing physicians to evaluate both anatomy and function in a single examination. These hybrid imaging systems have become an important part of cancer care, neurology, cardiology, and many other areas of medicine. Nuclear medicine technologists combine patient care, advanced technology, radiation safety, and pharmaceutical knowledge every day. Before an examination begins, they review the patient's history, explain the procedure, answer questions, and verify that the correct radiopharmaceutical has been prepared for the specific examination. Depending on the study, the technologist may administer the radiopharmaceutical, monitor the patient during the uptake period, position the patient for imaging, and acquire high-quality diagnostic images. Throughout the examination, technologists continually monitor image quality and patient comfort while following strict radiation safety procedures. Nuclear medicine technologists work closely with physicians, radiologists, and other healthcare professionals to help provide accurate diagnostic information that supports patient care. Nuclear medicine is used to investigate many different medical conditions. Bone scans help evaluate areas of increased bone activity, which may be associated with fractures, infection, arthritis, or certain cancers. Myocardial perfusion imaging evaluates blood flow to the heart muscle and can help assess coronary artery disease. Thyroid imaging helps evaluate thyroid function and certain thyroid disorders. Renal scans provide information about kidney function and urinary drainage. Ventilation and perfusion, often called VSQ scans, evaluate airflow and blood flow within the lungs. PET imaging is widely used in oncology to assist with diagnosing, staging, monitoring treatment response, and detecting recurrence for many types of cancer. PET also has applications in neurology and cardiology for selected clinical indications. Each examination uses a radiopharmaceutical selected for a specific clinical question. Because nuclear medicine uses radioactive materials, radiation safety is an important part of every examination. Radiopharmaceuticals are carefully prepared, measured, and administered using established safety procedures. The amount of radioactivity used depends on the specific examination and is selected to provide the information needed while following the principle of ALERA, or as low as reasonably achievable. Nuclear medicine departments also follow strict regulations for handling, storing, and disposing of radioactive materials. Some radiopharmaceuticals leave the body naturally over time through physical decay, biological elimination, or a combination of both. Patients may receive simple instructions after certain examinations, such as drinking fluids or following specific precautions, depending on the radiopharmaceutical used and the type of study performed. This is a common misconception. Most nuclear medicine examinations use small amounts of radiopharmaceuticals to create diagnostic images that help physicians evaluate how organs and tissues are functioning. Radiation therapy is a separate medical specialty that uses high doses of radiation to treat certain diseases, most commonly cancer. Although both involve radiation, they have different goals, equipment, and clinical applications. Here's an interesting fact. Some PET examinations can identify changes in tissue metabolism before structural changes become visible on other modalities. This ability to evaluate function makes nuclear medicine an important complement to other imaging modalities and can provide valuable information that influences diagnosis and treatment planning. Let's review what we've learned. Nuclear medicine uses carefully selected radiopharmaceuticals that travel to specific organs or tissues within the body. As these radiopharmaceuticals emit detectable radiation, specialized cameras record the signals and computers reconstruct them into diagnostic images. Unlike X-ray, kinetic, MRI, or ultrasound, nuclear medicine primarily shows how organs and tissues function, making it a valuable complement to anatomical imaging. Nuclear medicine technologists combine patient care, pharmaceutical knowledge, advanced imaging technology, and radiation safety to perform these specialized examinations. Over the past 4 videos, we've explored 4 very different forms of energy used in medical imaging. X-rays use ionizing radiation to create anatomical images. Ultrasound uses high-frequency sound waves to produce real-time images. MRI uses powerful magnetic fields and radiofrequency energy to visualize soft tissues in remarkable detail. And nuclear medicine uses radiopharmaceuticals to help us understand how organs and tissues are functioning. Each modality has unique strengths, and together, they provide healthcare teams with the information needed to diagnose disease, guide treatment, and improve patient care. Thank you for joining us for our How Medical Imaging Works series. Thanks for watching in the Know Medical Imaging. If you found this series helpful, be sure to like, subscribe, and share this video to spread more in the know about medical imaging. What medical imaging topic would you like us to explore next? Let us know in the comments. We'll see you in the next video.